So I wanted to talk to you because I got inspired, or I got very touched by your story, or not your story, but what you're going through. And the first thing that you shared with me was this. I have this picture of this waiting room, and you saying, "I got my ticket." That way that you told me how you kind of dealt with your diagnosis, and I wanted to hear if you wanted to share that,
Hmm.
if that's okay.
Yeah, of course. Yeah, well, it was exactly that. Because over the years, let's say over at least the last 10 years, which I started, in my opinion, my spiritual life 33 years plus ago, but for sure in the last 10 years, I often had these bursts, these explosions of, you know, just deep explosions of wanting to end all of this. Like, how much longer will I be doing this? I lived this life from day one because I just dived into it. Because for me, it was real. There was no mind. But I came to a point that, like I said, I had these moments often, in full being alone, doing whatever I would be doing, and then longing to end all of this. Not fighting this. I mean, you live and it's every day and you just go on, but how much of this will I be doing? How much more you want to put on my plate of what feels like the same, whatever it is. So when I got my diagnosis, I was like everybody would be. I think I was alone with my urologist. There was nobody there other than him and myself, and that's what I told him. I said, "You have to give me 1 minute. I'm an emotional being, and I just have to consider what you just gave me because I had no idea. There was no precognition." And then I said, "Okay, what are we going to do with this?" And that's where he repeated, "But, sir, this is a very serious diagnosis. Did you really hear what I told you?" I said, "Yes. But so it's up to you now. How do we go on here?" And that's why in my quiet, I was in that waiting room with this open door right in front of me, but knowing full well I was still waiting. But there was nobody else. I was alone in a waiting, just like a waiting doctor's waiting room, just a white whatever, standard chairs, all that stuff. And but that was real to me. So being eager to go through that portal, that door, I still was. But I had that happiness, like at least somebody reached out and said, "Here, kid, there you go." So that was just real for me. So that made me happy. You can't say that in a hospital, or even to a lot of people. They think you're crazy. They would have brought me to another ward. I told you that. They would have brought me to, the psychiatric ward for sure. Uh, I didn't care. Later on, I even was able to kind of explain that or to share that with my oncologist for sure, which is a wonderful woman, a younger doctor, but just great. When I told her, I just go on. I really have no trouble with it. At the contrary, it's just for those remaining, and everybody has that. Many patients with a serious diagnosis will tell you when they really come to the end, like, yeah, it's okay. I'm kind of okay with it. I got to digest that whole thing, but it's those I leave behind. But even there, if they live the same life. My eldest son, when I heard him first after my diagnosis, he immediately said on the phone, he said, "But of course, if anyone would get this diagnosis, who other than you, there's nothing for you to, you're not longing for anything, you're not after anything, I mean, and I didn't, had to explain anything. They just call it because they're living the same life in their own way, but the same life.
So when you went to the radiologist, what was the reason you went there in the first place?
I had some trouble, like many men do, I think, but then you blame it on your age. I was 63 at the time. That's 2 years ago now. And but just little things. I once had very severe back pain, which I knew did not come from my previous back surgery. It was something different, but it was only one night. It stole the whole night. I couldn't lay, I couldn't stand, I couldn't. I, but because it went away, I didn't relate it to anything. It was like a one-time happening. And then, yeah, I had a harder time peeing, the usual stuff. And you think, oh, wait a minute, did this happen overnight? Did I become 70 plus without my knowing? But there wasn't much more. And I started avoiding crowds and too much jitter, too much, wanting to be more on my own. It was too hard to deal with what would have been my normal day. But that happened gradually. It was more the people around me seeing that and thinking, hey, wait a minute, there's something wrong with him. Why would you go sit in the car to rest while we're having breakfast here in this place? Something like that. I said, because, I want to be quiet. I'm good, but just leave me alone. Let me be. So then the suggestion was, well, why wouldn't you just have a visit with your GP, which I did, and I had never seen him nervous, but he called me the day after or 2 days after in the afternoon, like, well, I made an appointment in the hospital because, your PSA is 447. And I said, well, doctor, you could say 1,000 or one, I have no idea. Because he had never tested my PSA, which you might not find logic. I didn't even know then. So that's how I ended up the same evening in the hospital with a urologist, which I didn't know anybody there. So I went on my own, and that's how it all started. They acted very fast because of the high numbers, and and they did an immediate MRI, and so the roller coaster started, and my treatment started the same day, the day after I stayed in the hospital, and they started injection and what everybody with serious prostate cancer goes through, hormone deprivation, which has its effects on the, you know, normal physical stuff you go through, chemotherapy, all that. And I'm still floating on that, which we know it's limited, but I still have to hold on to my ticket.
Yeah, because you're still here.
But I
It's
do. I have that ticket very close. I mean, you're not going to take that away from me anymore. No, no, no. Yes, even there, I had to, because after the initial, getting used to the new life, I realized that there was no end time on my ticket. It didn't say, it said you enter, the park, but it didn't say when the park is closing. So, but anyway, I'm in, that's for sure. And indeed, I seem to react pretty well to the meds, and so I go on. It's not easy physically, you know. You won't see me when I don't feel well. That's with everybody, not really being well. But you just live in another rhythm, completely other rhythm. There's no other way. But that's okay.
you know,
I go for the slope.
yeah. You shared with me a concept that I did not know existed, that you're part of a group that meets on these Zoom calls where you're a bunch of guys
Yes.
who has prostate cancer.
Yeah,
And
they call it the PC tribe.
I I I I somehow found these talks, not that you need to specific share, but the talks about the immediate problem a lot of guys have when they get this diagnosis. is that if it has, I mean, it has an effect on their life, but it's for sure will start having an effect on their sexual life. There's, it's like
That's
there's a
absolutely, that's the first. So I don't really fit into the group because it just made me happy, because that's all stuff I don't have to think about anymore. I'm not bothered by it. But also that you don't say in a group. Because the reason for these groups and these is mostly that they really need that social contact, and with those understanding what this is, because they're all living the same life, so there are no complaints there. Whatever you say, everybody knows. They all go to the same, more or less. One goes left, one goes right, but they're all on the same track. So that's the strength of these groups. But that's also what puts me off a little bit. I really have no need of social support, and I mean that's not how I live. I understand it, and I'm not down talking it, and I take part of the Zooms regularly, not always. It's at 2 a.m. my time, because it's happening in the United States. There are two different groups, and I would join more for the medical, which comes from it, experiences from other guys, real life experiences, not just the medical side, because in the hospital they just hear you what they see and think, and you go home with that. But then there's living it, and so that's the nice side of that. But yeah, it has its limits, I think. It's supportive for many going through because of course the other side in the last, not even a year, 5 or 6 of the members have passed away, because that's what this one group is. They're all metastatic, which means advanced. So when you arrive in the group, you do have your ticket, or you wouldn't be in that group. But so you get to know people, and then they drop out, and new guys come in. But coming in there, you're never new, because you're always in an ending story.
yeah. And also, Anand, you shared a beautiful thing about uh, how you want to prepare yourself. You didn't want to be so busy that you had your back to the door. You want to face the portal and you want to look into your future. I don't know if you can remember you sharing that. I thought that was such a beautiful way
Yes.
of looking.
Because to me that was very real. I always have, I think, have lived and reacted on just what I feel. And in fact, we all do that. That directs your moving, your move. But there was really that, and I was in the hospital. It was the first night. I'm in the hospital bed because I had to have different tests and all that, and a nurse trying to convince me that I was really sick and I would get depressed and all that. I had to almost push her out of the room, like, you know, if you have a happy patient, keep him that way. But anyway, that was the same night that I realized, because I got a call from someone interfering with my state at that moment, just out of curiosity and wanting to have a story, and it was just not nice, and that made me immediately shut down or shut off everything. Like, oh, wait a minute here. I knew immediately whom I would like and want to have around when the time would be there, and even walking towards that ending, because for me it was so clear. I had a vision. I was just there, and it was just like a white sheet. It was lit. I was completely like I would just throw a sheet over my head, and I would be wearing this white thing. And I thought, I will let nobody make that dirty, because I have to focus, and I want to focus on what this ticket brings me, and I have to turn towards that door, which I did already. I mean, there was no, but it was just a focus of that, and hence also the gratefulness that I knew that it would just drop whatever was in my life now or behind me, even just to leave it there. And I even physically, I started cleaning up my garden house, my closet. I just wanted to have an empty and a clean slate To me, that was so clear. And I think it's very logic because if you have the grace that you're given time, which we are all given, but we don't think about the fact that this will be ending. But when it's made clear to you because of your physical condition, and and you still get time to prepare, why would you not prepare? Why would I go to a concert in a wetsuit? I mean, I'll take time to dress up for it, for the occasion. And it's really that. You spend time to live your spiritual life. You meditate, you do all what you do because that's who you are, but you want to take care of the whole package. It's so logic to me. So if you come up to me and with a blame or whatever it is, and it's negative, why would I accept that? We shouldn't do that in our lives. Why would we? But we're human. We want to have everybody happy and harmony. And yeah, I think you're really entitled to just choose for yourself. Choose what is really good for you. Sometimes we don't dare because we have an income, we have a situation, we live someplace, we all that. But as you leave everything behind, which we all know, why would you be so attached to it? It's just wonderful to just be able to live with yourself.
If you could, if you could give an advice for somebody like a man who's going through what you are going and just can't find peace with what is happening, because it's once you get a diagnosis, two, you you are faced with the your maybe your sex life was so important for you. I mean, you have all these things you have to give, you have to get your head around. Is there any advice you could give any man going through what you're going?
I think it's mostly time because it's very delicate to share even in the groups I'm in because a lot of when I disconnect from the Zooms, it is for reasons like that. Because, for instance, it could start a certain Zoom call could start about the trouble one has with erectile dysfunction, and then everybody chimes in with the trouble and what they try and the penis pumps and all that stuff, and it's okay, but I can't take part of it because and I do in a careful way because when they do question and answer and they ask everybody's opinion, that so they just point is it and what about you? And I said, well, I'm very happy the way it is. I really have no need to change anything, and it's not even what people call acceptance, because that's still your mind that you accept it because there's a wall there and there's nothing else you can do. There's a wall there. You have to accept that. Well, that's not it. So it's not even that. It's the same thing again. But even if I mention it in a careful way, the thing about just try to find the happiness within you, knowing that it's you, and live on that. You can't really say that. Everybody walks their own way. They walk their steps, and they support each other in this because they're all in the same kind of mind place with all of that. It's not easy to go through. If you have no, we can't give a backbone to somebody. You build your own backbone in your life, yours, which I then would call your spiritual endeavor, whatever it is. We're so sweet, we're given a numerous possibility of ways to reach what every path would say, the happiness within you, the self, because it's all the same. They give us humans all these wonderful steps. And wherever you're born, there's something available there for you to grab onto. And we do. And whatever suits you, that's wonderful. But you know something? It's still all mind. That's still mind. Most of these paths are mind. Why? Because to overcome that, at least that thought process is heading in in that spiritual direction. and that's the good feeling of it. But you have to come, and or you come to a point that you really know what it means to live with your heart. You don't need all these rules. You don't need all these rituals. You don't. We all know that, but it's about trust. The trust only grows when the heart is there. Your heart has to be there. That's real trust. The rest is in here, and until something happens and you lose trust, you love that person immensely. You would do anything, and that person makes one wrong move, and you turn around and you walk away. I mean,
So it's kind of like stupid to ask you, but so you've never been afraid of dying, basically.
never, I can't tell because I can't think back that far, but for sure not in this life, which I call just my sadhana, my spiritual life. No, that longing has always been there.